So the ear is made up of mainly three parts: the outer ear, the middle ear and the inner ear.
What is the ear tube?
Which we put in the eardrum just to drain out the fluid from the middle ear.
Why do children or adults need ear tubes? What are the reasons? What is the lifespan of this tube? How is this procedure done? How to take care of these tubes?
So once diagnosed, there is an investigation, we call it as a tympanogram, because we are into the ear. Any slight movement can give rise to.
Will these tubes cause problem later on in the life?
Yeah, sometimes it can happen that really the child is not hearing properly or he is just acting.
Namaste everyone. Welcome to yet another episode of podcast. These are the podcasts where we try to identify a simple topic, try to understand it from experts' point of view, and try to give a simple information for general public. Today we are going to tune into a very interesting topic which most of us should know. We may have heard about it. Ear tubes. What is ear tubes? Why is it required? I am very happy. Today I am joined by Dr. Sanjay, who is an ENT doctor, ENT specialist. He has been practicing in UAE for a long time. Today we are going to discuss with him what exactly is ear tube and try to understand it further. Dr. Sanjay, welcome to today's discussion.
Thank you.
Can you tell us something about yourself?
Thank you, Dr. Amitabh. Thank you for giving me an opportunity to provide health awareness amongst general population. So I am Sanjay Kewalramani. I have been practicing in UAE since past 25 years. I was with the Ministry of Health Hospitals and now I am working in Dubai as ENT Specialist.
Yeah. Thank you, Dr. Sanjay, for your kind introduction. Now let's start our discussion, which is the main topic of today. Dr. Sanjay, for general person's understanding, for a layman's understanding, what exactly is ear tubes? If they may have heard about it, but they may not be knowing what exactly is it. So, for understanding of common people, what do you say? What exactly is ear tubes?
Dr. Amitabh, ear tubes are generally, in a layman language, we can say these are small tubes like a button. These are very, very minute tubes which we put in the eardrum just to drain out the fluid from the middle ear. So collection of the fluid in the middle ear, it is commonly seen in the pediatric age group, but sometimes adult population also have the issues of the middle ear and they also face the same problem. So indication for the middle ear drainage in the pediatric and adult, for main these two things we use the grommets to drain out the fluid from the middle ear.
Okay, that's very simple and easy to understand. From patient point of view, why do like children or adult need ear tubes? What are the reasons or what are the indications, conditions do we use these ear tubes?
Sure, Dr. Amitabh. So first I would like to explain you regarding the anatomy of the ear.
Yeah.
So the ear is made up of mainly three parts: the outer ear, the middle ear and the inner ear. Yeah. The outer ear has the eardrum. The middle ear has three small ossicles, the malleus, incus and stapes, and the inner ear has the nerve part which helps us in hearing. So whenever the sound comes to the eardrum, from the eardrum these sounds, they are magnified by these three small bones, as I told you, malleus, incus, stapes, and then these magnified or amplified sound waves are transmitted to the inner ear, which then go to the brain and then we can hear what the person is talking about. The middle ear is connected to the nose by a tube, we call it as the Eustachian tube. So the Eustachian tube, it is a small tube which connects to the middle ear. The other end opens at the back of the nose. So especially the kids, the pediatric age group in whom the allergies are very common, because of the allergies in the nose, these allergies cause dysfunction of the Eustachian tube, which causes a negative pressure in the middle ear and which leads to accumulation of the fluid in the middle ear, leading to hearing loss. So what happens is, as if you try to wade through a pool, or if you go to the sea, you try to walk through the water, walking through the water is quite difficult. Same happens in the middle ear. Whenever the fluid gets accumulated, the three small bones, they cannot vibrate properly, and then the sound waves, they come, they strike the eardrum, they couldn't reach the inner ear and the hearing goes down.
Okay, yeah, I got it. So then how is it done? How is this procedure done to put the ear tubes in the location or position wherever it is supposed to be there?
Yeah, so usually these cases, as I told you, if I say like out of 10, mainly 8 to 9 we get the pediatric cases, but few of the adult cases also have the same issues. In the adults, besides allergy, one very common cause is sometimes if there is any block in the nose because of any growth or sometimes because of any malignancy of the nose or the sinuses, it can also affect the functioning of the tube, leading to accumulation of the fluid in the middle ear. So mainly these kids are referred to us either by the pediatrician or the parents that themselves come to us that the child is not responding to their calls. Sometimes from the school the complaint is there, and in fact sometimes I had a child who was labeled as autistic because he was not responding to the calls from the parents, and then we further evaluated the child. It came out to be fluid in the middle ear, and then we did the tubes for him. So once diagnosed, there is an investigation, we call it as a tympanogram, in which an instrument is put at the external ear and the sound waves are sent to the eardrum. The reflected sound waves, they are taken as a graph, and according to the graph that we get, we can make out that what is going on at the back of the eardrum, because looking into the ear we cannot see what is going on at the back of the eardrum because it is a closed compartment. So after plotting the graph, we can come to know that yes, there is fluid. That is the graph that we get, either it is type A, type B or type C. Type A is a normal graph, type B, that means there is some fluid, type C, that means some dysfunction of the eustachian tube. Once we confirm our diagnosis, then we do the tubes. The tubes are done mainly under general anesthesia, and tubes are inserted into that part of the eardrum in which underlying these three ossicles are far away from that part. Putting the tube, it drains out the fluid from the middle ear. We do the suction of the fluid in the middle ear with the suction, and then these tubes are left over there, which helps in the ventilation of the middle ear, the ventilation of the eustachian tube, and the normalcy of hearing.
So it's it's a major surgery that needs a general anesthesia. Is it like that?
Regarding major surgery, Dr. Amitabh, basically the pediatric age group, it's very difficult to. It can be done as a outdoor surgery also, but in that we need a clear-cut cooperation from the child. That he should not move, because we are into the ear. Any slight movement can give rise to trauma or damage the inner ear or the middle ear ossicles, which can give rise to further hearing loss. So we prefer to do it given full anesthesia. The child is lying on the table, operation table, and conveniently we make a small incision, we put the tube, we drain out the fluid, and we come out.
Yeah, so viewers, please understand that this surgery should preferably be done under general anesthesia, not because it's a very complex surgery, but because most of the time it is in children, and children we have to be a bit careful when dealing with them. So Dr. Sanjay, when a surgery is planned, how long does the surgery last, like for a children or an adult?
For the adults, we prefer to do it in the OPD settings also. So it's a very quick surgery in which we just apply some anesthesia on the eardrum and we do it in the OPD under the microscope. But mainly for the children, we do it under general anesthesia under the microscope. Hardly it takes 5 minutes to make an incision, to put the tube and to drain out the fluid. Overall, the surgery time at max from the child coming to the OT, going out from the OT, hardly takes 1 to 1.5 hours. Recovery is very quick, like another 1 to 2 hours, like till the time the child comes out of the effect of the anesthesia medicine, and then after 3 to 4 hours, child is fit enough to go back and to resume his day-to-day activity.
Yeah, so that's very reassuring to know that it's like not a long surgery. In adults, sometimes it can be done as an outpatient as well. But children, as we all of us know, we have to be a bit extra careful, and they may not be cooperative even for a single prick. So it is preferred to do it in general anesthesia. So it's reassuring again to know that it's like 1.5 hours and patient can, it's done. So once the surgery is done, what exactly the person, child or a patient should expect? How many days does he have to stay in hospital, or he can just go home same day?
So as I told you, immediately after the surgery, 3 to 4 hours, once the child starts orally, he can go back to home. Regarding the precautions at home, that is very important part, because we have made an opening in the eardrum. That means the middle ear is directly communicating to outside. So the tubes are there at least for 6 to 12 months. So at least for 4 to 5 months, the parents have to be very careful about water entering into the ear. Not even a drop of water should enter the ear, because if the water goes in the middle ear, it gives rise to infection, it gives rise to ear discharge, and it sometimes gives rise to early rejection of the tubes, and tubes sometimes without serving the purpose, they are ejected out because of the infection of the middle ear. So my request to the parents are, after the tube surgery, at least for 3 to 4 months, they have to be very careful that no water should go into the inner ear. Whenever giving bath to the child, they should take all precautions, either using using cotton with Vaseline or putting the earplugs, that water should not go inside the ear. So now let us say 4 to 5 months are over, the tubes, they have served their purpose, then it is an auto ejection method of the body. Like after 5 to 6 months, the tubes automatically, they are ejected out slowly. They start moving out from the eardrum opening, it closes on its own, and gradually the tube, it moves out and it falls out from the ear.
So yeah, that's a very detailed explanation. So what is the lifespan of these tubes? How long do they stay inside the body?
So as I told you, they are there at the most from 6 to 12 months, but
Okay.
most of the cases within 4 to 5 months I have seen the grommets or the tubes, what we call, they are also known as grommets, they fall on their own in 5 to 6 months. And the recent advancement, I just would like to tell our listeners that now we are having bio-absorbable grommets. Very soon they'll be in the market. Right. So they will be inserted and within 5 to 6 months they will be bio-absorbed on their own, so that you don't have to come again and again to the doctor that whether the grommet is out or whether the grommet is still there. Like after 5 to 6 months they are absorbed by the body on its own without any side effect. Very soon these kind of grommets or ear tubes are going to be launched in the market.
Yeah, so it is good to know that newer advanced one are bioabsorbable, but the one which we have been using or the conventional one, do patient have to come to doctor to get it removed or it comes out on its own then?
Until unless there's no issue with the child, like sometimes with the grommets, the child, they get infection, they complain of ear pain, then in that situation they can come to the doctor who has done the surgery for the child. Otherwise, usually I call the patients usually after 5 to 6 months of the surgery only, not before that.
Okay, so once they are in or they come out, we understood the process. But if it stays inside, what are the risks involved in if a ear tube stays inside the body?
Yeah, sometimes it can happen. Most of the times it is ejected out, but sometimes the reverse migration also takes place of the grommets. Okay. So in that situation, the grommet, instead of coming out of the body from the external auditory canal, it migrates in the reverse position, that is, it goes towards the middle ear. So in that situation, even if the grommet goes to the middle ear, it is not going to cause any harm to the hearing or any harm to the child. Usually when it goes to the middle ear, we don't try to pull it out, because sometimes pulling out may dislodge the 3 minor ossicles in the middle ear that can give rise to permanent hearing loss. So in case if the grommet, it migrates in the reverse direction, we just leave it as such. We don't try to retrieve it.
Yeah, I understood. Yeah, so these are the risks which we need to know, viewers, that we have to be extra careful, we have to take extra care, as Dr. Sanjay clearly mentioned. So coming to the advantages, like that will be probably the common question asked to you, will my child be hearing better after ear tubes? So how do you answer those questions when you face in OPD?
Of course, so to begin with, the indications of tube, as I told you, is collection of the fluid in the middle ear. So usually the child, when it's referred by the pediatrician or directly when the child being seen by the ENT and the child is complaining of infection I should say, like about 3 to 4 times the child is having ear infection in past 3 months, then it becomes an indication for proceeding the surgery. So the child, what we tell to the parents is, initially for 8 to 12 weeks we can try with conservative medicines, that includes anti-allergic, antihistaminics, nasal sprays, steroid nasal sprays. For 8 weeks we can wait for the fluid to resolve on its own. But even after 8 weeks of treatment, if we get the flat curve in the tympanogram, that is still if the fluid is there in the middle ear, then we should go for the procedure. So if we leave it for long, this fluid, I had few of the cases in which the parents, they neglected it. So they came to me, let us say one of the child, he came to me after 4 months of the diagnosis, in which to remove the fluid, in 4 months that fluid had become thick as a glue. In pulling out that secretion, you may dislodge, you may traumatize the the 3 ossicles which help in the sound conduction. The ossicles, they may get dislodged because of the thickened glue in the middle ear. So I advise the parents, if within 8 weeks of treatment still the fluid is there at the back of the eardrum, better to go for the tube surgery, which is a very small surgery with immediate relief to the child, especially in hearing.
Got it. It a very detailed description. Will these tubes cause problem later on in the life?
Usually once the tubes are ejected out, the eardrum heals on its own, leaving a small scar mark. But this scar mark doesn't cause any issues. In some of the situations we have seen, Post grommet insertion or post tube insertion, there is a remnant perforation. The remnant perforation is usually seen in the cases in which after the grommet insertion the child must have had the issues of middle ear infection. In that situation, sometimes once the grommet is ejected out, the perforation is left behind. So in that situation, sometimes we have to go for the surgery of repairing of the eardrum because of the grommet which was done in the childhood for the patient.
Okay, so viewers, please try to understand that once the tubes are ear tubes are fixed inside by the doctor, the job is not over. You still have to take extra care of the tubes at home, as Dr. Sanjay just mentioned. So Dr. Sanjay, when do the patient need to call doctor in case if he's not understanding whether it is working, not working, whether there is any problems related to the ear tubes which are inserted? So when should they approach you, or when should they call you for this?
Usually once the procedure is done, I call the patient for follow-ups first month only. After that, in case of any pain in the ear, any discharge from the ear, they should come and they should see the doctor who has done the grommets or the ear tubes for the child. There are some ear tubes which are there for long term. We call them as long term ear tubes. These are inserted mainly in the kids like having Down syndrome or having issues with the eustachian tube dysfunction. So these tubes usually once they are inserted, they don't come out on their own. Like they are there for years together, and sometimes if causing trouble, then we have to pull them out. Some of the adults also are there who have a chronic eustachian tube dysfunction, in which we insert what those tubes are known as T tubes. So these T tubes, these are the long standing tubes which are left over there for 5 years, 6 years, and then after 6 years or 7 years, again if the patient is having issues of hearing, they can be removed and we can wait again and they can be reinserted. So once tubes are done, after a month should go to the doctor. After that, you should visit the doctor if there is any complaint of any ear discharge or any pain in the ear.
So we got it. Now one last question, how to take care of these tubes as a layman or a general parent? What precautions they should take, or what care they can do at home so that the ear tubes are maintained well and it's giving the maximum benefit to the child?
Sure. So you have to be really careful about the tubes, because if the tubes are ejected out because of if they are not being taken care properly, if they are ejected out before the time, then again you have to go for the reinsertion of the tube. That means again to undergo the general anesthesia and all those pre-operative investigations. So to be taking care of the tubes, you have to be, the first and foremost thing is you have to be careful about water. No water should go into the ear at least for 3 to 4 months once the tube surgery is done. In case if any water goes in, usually post surgery we advise some antibiotic steroid drops to the parents. They should be kept handy, and if by chance or by mistake any water goes in, you can use those drops at least for 3 to 4 days. And if within 3 to 4 days any symptoms come up again like pain or discharge, you should visit the treating doctor.
Yeah, thank you very much, Dr. Sanjay, for simple information related to ear tubes. Now coming to the last question, which may be interesting, is there any myth about ear tubes which you may have heard of, and but it's probably not there and it's just a misconception?
Yeah, basically first of all, parents, they don't accept this, that the child is having an hearing issue, and this hearing issue can get complicated if not treated timely. I do have parents in which the tympanogram straightforward, it shows a flat curve, and then when I advise them for the ear tube surgery, usually they try to avoid it. And most of the pediatric cases of ear tube issues, they are also associated with adenoid enlargement, because adenoids are there at the back of the nose. The other tip of the eustachian tube which opens in the nose, the adenoids, they lie just on the top of the eustachian tube. So once the adenoids are enlarged, that is, child is having snoring, mouth breathing, these are the kids who are most prone to develop middle ear effusions. So usually when we go for the tube surgery, we go for the adenoidectomy also, the root cause of collection of the fluid in the middle ear. So my advice to the parents is not to neglect the child hearing issues. If any complaint is from the school, or if you notice the child is not responding properly, it's a very simple investigation of tympanogram. It's a non-invasive investigation which can tell us that really the child is not hearing properly or he is just acting. So if any hearing issues, just visit the doctor, get the hearing checked, and try to find out the cause of the hearing issue and try to get remedy of it.
So, viewers, this brings us to the end of this interesting, insightful discussion. Dr. Sanjay, thank you, Dr. Sanjay, for
Thank you, Dr. Amitabh.
this information. Please try to understand that the purpose of the podcast is to give the information from experts in that field, to empower people with the correct information instead of unverified information from different websites. So I'm sure many parents must have had lots of doubts related to ear tubes, speech of the child, hearing of the child. And I hope this podcast with Dr. Sanjay and the detailed discussion from him must have helped these parents or patients for understanding what exactly is ear tube, how is it inserted, what precautions you should be taking, and what are the after effects, how it comes out, what are the complications, how to take care of these ear tubes if your child has had this ear tube. Viewers, please, if you have any questions or any doubts related to this particular topic, you can write in the comment. You can share this information, you can share this video with the parent or person who needs to understand this ear tubes related information, so that it will benefit his child or relative. If you have any suggestion related to any topic related to ENT from Dr. Sanjay, please write it down in the comments, and we'll definitely try to accommodate, provided Dr. Sanjay is ready to come again and discuss with us about this. Thank you very much again for listening to the podcast. Take care of your health, take care of your ears. Thank you, Dr. Sanjay.
Thank you very much. Thank you.